Anatomy of the wrist. The wrist consists of 8 small bones called carpal bones. These bones are arranged in 2 rows. Proximal row, closer to the forearm scaphoid, lunate, triquetrum, pisiform. Distal row, closer to the hand trapezium, trapezoid, capitate, hamate. The wrist lies between the forearm bones, radius and ulna, and the metacarpal bones of the hand. Joints of the wrist. The main joint of the wrist is the radiocarpal joint, between the radius and the proximal row of carpals. There are also carpometacarpal joints between the distal row of carpals and the metacarpals. Proximal row of carpal bones 1. Scaphoid. Largest bone in the proximal row. Boat-shaped, located on the thumb, radial, side. Articulates with the radius and trapezium. Clinical note, most commonly fractured carpal bone. 2. Lunate. Crescent, moon, shaped bone in the center of the proximal row. Articulates with the radius proximally and capitate distally. Clinical note, common site of dislocation. 3. Triquetrum. Pyramid-shaped bone, located next to the lunate on the ulnar side. Articulates with the hamate and pisiform. Clinical note, third most frequently fractured carpal bone. 4. Pisiform. Small, pea-shaped sesamoid bone. Lies on the palmar surface of the triquetrum. Serves as an attachment point for the flexor carpi ulnaris tendon. Clinical note, increases the leverage of flexor carpi ulnaris. Distal row of carpal bones 1. Trapezium. Irregular quadrilateral-shaped bone. Located at the base of the thumb, first metacarpal. Important for the carpometacarpal, CMC, joint of the thumb, which allows opposition, thumb-to-finger movement. 2. Trapezoid. Small, wedge-shaped bone. Found between the trapezium and capitate. Articulates mainly with the second metacarpal, index finger. Provides stability to the index finger. 3. Capitate. Largest carpal bone, centrally located. Head-shaped, its name comes from capit equals head. Articulates with the third metacarpal, middle finger. Serves as a keystone for wrist stability. 4. Hamate. Wedge-shaped bone with a distinctive hook-like projection, hamulus, on its palmar surface. Articulates with the fourth and fifth metacarpals, ring and little fingers. The hook of hamate is an important landmark for the ulnar nerve and artery passing nearby. Clinical note, can fracture from trauma, common in racket and club sports.